guys, I decided to do my talk on centering pregnancy care. This topic is really near to my heart. I had the privilege of working at the OBGYN Center for 5 years and got to experience how amazing centering can be for patients. How many of you, first of all, what I'm wondering is, how many of you know what centering is? I definitely did not know what centering was before I started working at the OBGYN Center. It's not typically offered, it's more often offered in lower income and more vulnerable populations because that is where it is shown to have the most influence and positive effects. So centering is prenatal care that is incorporated into a group setting, and it kind of, in one appointment with 8 to 12 other women, it encompasses the risk assessment, so the exam and checking on the patient, education, and support. And usually it's about 8 to 12 women, like I said, and they're all in the same group based on delivery date. They meet for 90 to 120 minutes for approximately 10 sessions, and then one for one postpartum. So there's a lot of reasons why centering is good, both for the provider and for the patient. One of the benefits of centering, obviously, is for the patient. The patients get so much support. A lot of these lower income, vulnerable populations come from situations that a lot of people just have no idea, what it's like living in their shoes. And I've seen a lot of really, tough situations and women that just thrive in centering because of the community that they get. They also get such amazing education and in-depth, whereas, just longer education appointments, whereas, for individual prenatal appointments, typically, 10 to 15 minutes. These are longer sessions with much more encompassing education. So some of the benefits of centering are preterm birth is decreased for low income and African American women. And so with preterm birth, you're considering, low birth weight infants are decreased. Less time in the neonatal intensive care unit is also one of the benefits. And also with preterm birth, you increase risk of disability and mortality. So that's also helped with centering, because centering decreases the risk of preterm birth for those populations. Another benefit of centering is increased breastfeeding rates in African American and teen moms. Another thing, this was interesting, women, one study found that women who smoked at the beginning of pregnancy were 5 times more likely to quit when they were in a centering group than just in individual care, which is amazing. You have a lot of women that I would see at the clinic, and they smoke as their coping mechanism a lot of times, and with centering, a lot of times they would feel like they had that support that they needed as an outlet to help them quit. One of the amazing benefits of centering that several studies have found are that diabetes outcomes are better for vulnerable populations that participate in centering. And with the diabetes study, they studied breastfeeding. There was a higher rate of breastfeeding for the diabetes women that participated in centering, higher rates of strictly breastfeeding at 6 weeks postpartum, which is great because a lot of people, it's just not what they think and it's harder, but the people with centering, they speculate that they just get so much education that they are more successful. So they are also, the diabetes patients are less likely to need drug therapy or intensive drug therapy than women in individual care. There are even more benefits of centering. It really is amazing for these women. And this is really for the provider, there is a decreased rate of no-show for the patients that are in centering as opposed to individual care. They want to come to their appointments. It's their support group. It's their friends. They grow to really love each other, and they really crave that community. Women are more likely to report receiving thorough and adequate education on exercise in pregnancy, breastfeeding, and baby care. And they're more likely to feel valued by their provider and that their provider was interested in how the pregnancy was affecting their life. Another huge plus is that they're more likely to choose reliable contraception after delivery. And this is speculated, again, due to the education that they receive in centering. So a lot of times these women will choose a long-acting form of contraception, which is really good because it decreases the unintended birth rate, which is huge everywhere. And then they also have reported increased satisfaction in the vulnerable population. So what? Why is this important? Well, one of the huge things is money. Medicaid pays for over half of the births in the state of South Carolina. And if you can prevent preterm birth, that's huge. For every preterm birth prevented, it's estimated that a minimum of $23,000 is saved. And that doesn't even consider, NICU costs and then different things like that. Also, money is saved from breastfeeding. If moms are if there's increased breastfeeding, there's not as much Medicaid dollars spent on, formula and things like that. So the potential savings are just huge. They found that one facility alone in South Carolina saved $450,000 from implementation of centering. So for us in Greenville, like providers, it is available to us in Greenville at the OBGYN clinic. So if we as providers have this available and you have a teen mom or a just low income, vulnerable population that you feel like, hey, they could really use the support, this would be a perfect setting for them. Refer them to the OBGYN center. It really is amazing for these moms to experience the support and the community that they get in centering, and as well as the education, of course, because a lot of them don't have access to the education. A lot of vulnerable populations are a lot less likely to sign up for perinatal education. And then the other, so what is that if we can help improve preterm birth, low birth weight, and NICU outcomes for the state of South Carolina, we want to do that by referring these patients that are a good fit for this program, because South Carolina is they're number 40 something in all of those categories. So of course we want to improve those outcomes. Thank you for listening. I hope you have learned about centering and that you would consider it for your patients that would be a good fit. And thank you so much for your time. Bye-bye, guys.